there a solution to my under eye bags other than surgery? I was told injections are not an option for me. Are there other solutions to my eye bag problem? Please help.
Thank you for your question. You submitted a single photo and you're asking, is there a solution for your under eye bags without surgery? And you were advised that injections were not an option. Well, let's take a look at your photos and let's analyze what's going on. I'll share with you my approach when I meet someone like yourself in my practice. I'm a cosmetic oculofacial plastic surgeon practicing in Manhattan and Long Island for over 20 years. This means that I have a background training in eye surgery and specialized training in cosmetic and reconstructive surgery of the eyes and face. Under eye bags is an issue we deal with every day in our practice. The desire to avoid surgery is always natural. And when we look at your eyes, you see significant puffiness under the eyes. In addition, as a side note, that even though you didn't mention in your question, your upper eyelids are actually relatively low, and I would say that you appear to have a condition called ptosis, or drooping of the upper eyelids. But getting to the lower eyelids, essentially what you're dealing with is an anatomic issue. That means that the fat that's normally around the eyes have pushed forward and created this bulge and puffiness. And so naturally there is no way to push the fat back and to reinforce it without some type of surgical procedure. What we refer to as lower eyelid fat prolapse or herniated fat. You can think of it almost like a hernia in another part of the body. You have to have some type of surgical procedure. Practicing for 20 years, I've learned a lot from my patients as to what are the concerns about having surgery. And I would say highest in terms of concerns has to do with anesthesia. In our practice, what we've developed is a method of sedation, which means instead of going under general anesthesia, which is usually a less appetizing prospect when you have to think about being put under general anesthesia, where a tube is put in your throat and your body is paralyzed and you put on a respirator. That can be pretty intimidating. What we do is local anesthesia. That means like going to the dentist's office and getting a little injection of local anesthetic, but at the same time we give you some light sedation. And this is something that has been very successful for us. We're able to make our patients comfortable and at the same time avoid general anesthesia and do the procedure very efficiently. A lot of times people also feel that injections are less invasive than surgery. But the reality is once you have gone past that superficial level, it is invasive. Injectables can create complications and problems, including infections or something called embolization, where you can get into vessels you don't want to be in, and create problems that one would never expect because it seems innocuous to have an injection. But injection and surgery are more similar than you would believe from a non-medical perspective. So in someone like yourself, someone with dark skin and someone who doesn't appear to have excess skin, what I would generally do is a procedure called a transconjunctival blepharoplasty. Now it's a mouthful, and it basically means I'd work from the inside of the eyelid, and that way I can avoid any external incisions and scars. It's very important with people with dark skin to be mindful of the issues with pigmentation related to incisions, hypertrophic scars or thickened scars, very often referred to as keloids, and of course all of the subtleties that have to do with the unique issues of different ethnic skin types. Many years ago I wrote an article called Ethnic Considerations in Eyelid Surgery, and I tried to explain to every patient that there are unique issues that are related to the genetics and the anatomy of different ethnic backgrounds that have to be factored in terms of the method of the surgery as well as supportive procedures. We routinely apply the use of something called platelet-rich plasma to help skin quality. Platelet-rich plasma is derived from your own blood, and what we're doing is essentially concentrating the wound healing or growth factors that help stimulate collagen, and it improves color, it improves quality, and it improves the blood supply to the skin. So this method of combining minimally invasive approach, which is from the inside of the eyelid, with local anesthesia with light sedation, combined with platelet-rich plasma, has been a very good method for us in our practice. And again, for over 20 years, this has been a major focus for us. And we certainly find this procedure to be very gratifying. If there's one thing a lot of people will do in their whole lives in their face, it'll be addressing the puffy bags under the eyes. I always am so impressed by how it brightens up a person's face to have the bags gone, and it just makes the eyes look more bright and awake. In your situation, you may have to also explore ptosis. I don't want to add more anxiety to your life, but I think it's important that you understand all the issues so that if you're going to move forward with the procedure, you learned all of the things and not just partially. A lot of times communication is one of the biggest challenges between plastic surgeons and patients, and so in our practice it is teaching and educating is of the highest value for us, so that our patients really understand what their risks and benefits are before they move forward with the procedure. In your situation, a more extensive examination will at least reveal your issues, and then you can decide if and when you want to deal with them. Just because you have these diagnoses doesn't mean you have to address all of them, but you have to set expectations appropriately. So I think that you should look, if you want to reduce the puffiness under the eyes, you're going to have to embrace and get used to the idea of having some type of surgical procedure. Meet with cosmetic surgeons, review their results, get a sense of the feedback of how their patients recover, and take it from there. But I think that once you do this, you'll experience what a lot of our patients say. And what a lot of our patients say, things like, if I knew it was this easy, I would have done it sooner. Now, I'm honored and flattered by that, but I never say that the procedure is easy, but it certainly is predictable within reason to get a nice result. Again, it's all about communication and management of the procedure in the most optimal way. So I hope that was helpful. I wish you the best of luck, and thank you for your question.